Hey everyone, it's Sarah with RegisteredNurseRN.com, and if I were starting a new job on a floor as a new nurse, here's everything that I would want to know about that floor. So first, protocols. You want to be familiar with almost every type of protocol that you're going to encounter on that floor. It can be anywhere from a medication error to a patient falling to starting a certain medication. So you want to know where to find those. Are they in a big notebook on your floor where you can just go and access them? Or is it online through like a specific web portal? So I recommend that you find those, print those off, and just review those so you can get familiar with them. Next, you want to be familiar with important document forms that you're going to need throughout your shift, because there's nothing like you're in a rush, you're trying to hurry up and find this form for this patient, and you're looking everywhere and you have to spend time looking for this specific form. I would hate when that would happen to me. So what I recommend is that whenever you first start your job, just take a moment, look at these forms. It really depends on how your unit's set up. A lot of units will have them labeled where they're at, but just take time and look and say, okay, here's the informed consent sheets. Here's the pre-op checklist. Here's this, here's that. That way it'll be a lot easier to find them when you need them. Next, you want to be familiar with which healthcare providers go with which group, because a lot of times you're going to be getting admissions and this patient's going to be with this doctor, and you need to be able to remember, okay, this patient is with this provider group. Or you may get a consult to consult nephrology, this certain group, and you're going to have to know, okay, this nurse practitioner is with this group or this PA is with that group. So just take time to look at the doctor groups, who's with who, and just memorize which group's which. In addition, you want to be familiar with the names of people and departments that you're going to be calling regularly throughout your shift. Like for instance, you want to know how to get a hold of pharmacy, lab, supply, transport, x-ray, so forth, because these are departments that you're probably going to be calling quite a bit during your time as you're working. And whenever you're not calling these people, you want to be familiar with the programs on how to communicate with them. Like for instance, let's say you have to order some supply. Know how to place an order in supply so you can get that for your patient. Or you need to transport your patient to a different department. Know how to use that program to get that done. So whenever you have time, especially during orientation, really play with the software. Have other nurses who are needing patients to be transported or they need to order supply, let you be the one to put it in so you can get a lot of experience with this. Next, a really important thing is that you want to be familiar with the location of the crash cart. So go on your unit, find where that crash cart is, and then just look through it. I know a lot of it's locked up, you can't just access everything, but review where everything would be. A lot of times during nurse residency programs or even orientation, they will have an open crash cart for you, and you want to be familiar with where the supplies is in case you have to hand it to someone during a code. And you want to make sure that you check out the supply closet or the supply room located on your floor. So you just want to go in there one day and you just want to scan the room and you want to make mental notes of where everything is located. For instance, you want to know where bags of fluids are, like normal saline. Where are you going to get that? Where's the IV tubing? Where's the supplies to start IVs? Where's your flushes? So I really recommend that you go in there, because there's nothing like being in a super big rush and you need something really fast for your patient and you have to stop and spend like 5 minutes trying to look for it. You want to be able to go in there, grab it, and get out. And finally, as time goes on, you want to make sure that you start to get familiar with the skill set of your colleagues, because whenever you're first starting out, you may be a little nervous or a little rusty or may not even know what to do in a certain situation. So you want to know which other nurses on your floor have that wisdom that you need in order to get the job done. So make sure that you start just thinking about that and assessing who can do what. Okay, so that wraps up this video, and these are things that I would definitely consider prioritizing that I would learn on the floor as a new nurse, and I hope that helps you. And if you'd like to watch more videos in this series, you can access the link in the YouTube description below.